Hi, I'm Dr. Boom. I'm an internal medicine doctor. My mission is to teach, inform, and hopefully entertain you as you watch this video. My aim is to break down medical conditions, treatments, and medical jargons to something you, the viewers, can understand. Stop, or it will kill you. Today, we will be talking about dangerous types of chest pains. But wait, isn't it that all chest pains are dangerous? Well, it may be right, as all chest pains have the potential to turn to something really dangerous. If there is only one takeaway from this video, is that all chest pains should be evaluated by a medical professional right away. And if deemed serious, one must be taken to the hospital right away. Or better yet, one should go straight to the emergency room. So now we will discuss the first type, the feared heart attack, or in a fancy medical speak, acute coronary syndrome. It usually presents as such. Pain occurs at rest, getting longer in duration, worsening, occurring with less exertion. So why is it that it's so dangerous? So what really happens in a heart attack? So here's a drawing of a very smooth vessel here that, when we were born, our heart vessels were pristine, so blood can flow really smooth there. But as we age, our heart vessels begins to clog. This is due to the damage done to the lining of our vessel caused by the sheer force of the blood passing through the lumen. The higher the pressure, the greater the damage. Our body tries to fix it, but in the process, it forms this big plaque. Our body then tries to stabilize it by coating them with hard substance. In some people, this plaque breaks off and results in clogging a smaller vessel, causing heart attack. But in most cases, this plaque rupture and the body tries to seal it by attracting platelets. In some instances, there was an overreaction to the platelet forming blood clots that totally occlude the vessel. When this happens, the heart muscle being supplied by that vessel becomes weak and unable to help with the pumping action of the heart. In extreme cases, the muscle dies, and this is what makes it dangerous. Now, this event can be diagnosed with changes in the electrocardiogram, or the EKG. It's the machine that records the heart, its electrical system. If there were changes in the pattern, the doctors will be able to see it. Also, in cases of heart attack, the troponin steeply rises. The troponin is a protein found in muscles if there was a damaged muscles. These proteins leak in the blood. Patients with heart attack needs to be treated right away with heart cath. This is a procedure where catheters pass through the vessel in the wrist or in the groin, going through the heart, where the clogged vessel is accessed and opened through balloon angioplasty, with or without a stent. If there were too many vessels involved or an extensive main vessel is blocked, then bypass will be done. It is a surgery where a vessel will be harvested in a different part of the body and then placed to go around the blood vessel to restore blood flow. The next type is pulmonary embolism. This is mainly due to one or more blood clots in the lung vessel. It presents as shortness of breath, pain especially on deep breathing, and movement, as well as cough. Why is it dangerous? Again, let's go to the illustration. Well, pardon my drawing. I'm not really a good artist. Now, this is the lung, and these are the vessels that supply the lung. Now, if a blood clot appears here, this is the part of the lung which relies on this vessel. And to be able to function, this part of the lung needs the blood supply. And if it doesn't receive that blood, it is compromised and can lead to tissue death. It can also put a lot of pressure on the heart, which can also compromise its function. This is mainly diagnosed through a chest CT angiogram. And pulmonary embolism is treated with blood thinners, which are called anticoagulants. Examples are warfarin and the newer drugs such as Xarelto or Eliquis. The next type is tension pneumothorax. By the name itself, pneumo means air. Thorax is the chest cavity which causes significant tension. The part of the lung is leaking air, trapping it in the chest cavity, which causes tension, and it displaces the chest structures. It can lead to sudden death from cardiopulmonary collapse. This usually happens in patients with trauma to the chest, those with emphysema, where a bleb or part of the lung which has overexpanded suddenly burst. To illustrate, this is again the drawing of the lung, and say this part of the lung is the one which has a bleb or suddenly burst, causing air to escape, and the air is trapped in the chest cavity. Since it is a closed space, the pressure builds up, causing the lung to collapse, and as more air gets trapped, the heart, which is located here, can be affected as well. This is an emergency, a life and death situation. To treat this, a chest tube needs to be inserted right away to relieve the chest pressure. In some cases, the body will eventually heal on its own and the chest tube can be pulled out. If not, surgery is performed. The next one is rupture of the esophagus. It can be caused by powerful straining or vomiting, symptoms such as excruciating pain, mostly localized in the deeper part of the chest. I have seen several cases of these patients who binge on alcohol and had excessive vomiting, leading to the rupture of the esophagus. Now, to illustrate, the esophagus is a tube that propels our food from our throat here and connect it to the stomach. Say, if a rupture happens here, the contents can spill to the chest cavity, causing severe inflammation. Now, this condition is treated with surgery. The last one is called cardiac tamponade. This is caused by fluid that accumulates in the space surrounding the heart. With this fluid buildup, there is a pressure that prevents the heart from pumping blood to support the body organs. This can be seen in patients with infection of the sac that envelopes the heart, trauma, or anything that causes inflammation to the sac. Now, this is dangerous as the heart is enveloped by two layers. The one is adherent to the heart itself, and the other one is a thick covering with potential space forming around between them. If there's an inflammation, the fluid that collects to this potential space and causes pressure. The outcovering, which is this one, is a thick one and can only expand to a certain degree. If too much fluid is produced, it creates an extreme pressure which collapses the heart, making it difficult to pump blood. This again is a medical emergency. The fluid needs to be drained right away, either by pericardiocentesis, where a needle is inserted straight to the chest to drain the fluid that has accumulated in the sac around the heart. The other treatment is called pericardial window, where a surgeon will make some incision, expose the sac, and removes a portion of it. Then drains the fluid and place a small tube so that the fluid can drain into another cavity to prevent the buildup of fluid to the area surrounding the heart. Now, in summary, these are the list of the dangerous types of chest pain. Thank you for watching this video. I hope you subscribe to this channel. Don't forget to press the like button. See you next time. God bless.